Hi, I'm Jack Jamieson. I'm presenting on behalf of my co-authors, Daniel A. Epstein, Yunan Chen, and Naomi Yamashita. Our research was focused on unpacking intention and behavior to explain contact tracing app adoption and hesitancy in the United States. So contact tracing apps are smartphone applications that alert people if they have come into contact with someone who's tested positive for COVID-19. They've been found to be effective at reducing the number of COVID-19 infections, and essentially a higher number of people who use these apps leads to a greater reduction in cases. Importantly, they enlist individuals to address a collective challenge. So the lessons here are important not just for contact tracing apps or for the pandemic, but for future collective social problems. Most governments and public health agencies targeted an adoption rate of about 60%, and early survey research suggested that over 70% of people were willing to install a contact tracing app. The outcome has not reached those goals, however. Globally, most countries have had about 20% adoption. In the United States, it's been about 14%. So individuals' decisions about whether or not to use a contact tracing app are quite complex, so we set out to better understand those. Specifically, our analysis focused on whether contact tracing app adoption can be characterized by an intention and behavior gap. So when people say they will do something, it's a quite good indicator of whether they will actually take that action, maybe the best indicator that we have, but it's not perfect. Various studies put the correlation between intention and behavior between 0.3 or 0.6. So we investigated this with a survey of 290 USA residents in December 2020. Our survey design basically entailed asking our participants about their attitudes towards contact tracing apps, whether they had installed an app or intended to do so, as well as their trust in society, their everyday life conditions, attitudes towards the pandemic, and so on. Now, not every state has a contact tracing app, so we described a hypothetical example to our participants that matched the kind of overall common design in most states. So our first research question investigated people's attitudes towards these apps. They generally had positive impression, noting that this would be useful, they thought, for containing the spread of the pandemic. However, many people said this would have a minimal impact on daily life. There were some concerns about relying on other people, such as this person who said the app depends too much on the goodwill of other people, and that's not working currently. And some participants had surveillance and privacy concerns, thinking that these apps might be monitoring them. So at the time of the study, contact tracing apps were available in 22 states. So our second research question investigated whether intentions to install an app was different between people in states where an app is available or where an app was not available. In other words, could it be possible that people have a different opinion when they've seen an actual app become available in their area? To answer this question, we divided our participants into these two groups, and then we looked at their intention. We found that in both groups, about 55% said they would probably install, definitely install, or had already installed. The main difference was, of course, that people in a state where a contact tracing app was available, there's a significant group of people who had already installed the app. The main takeaway, though, is that there was not a major difference in intention, overall intention, between states where an app is available or where one is not available. Our next question then focused on participants in a state where a contact tracing app is available. And we asked, what are the differences between people who say they would install an app but have not done so, and between people who actually installed the app? So we investigated this with two regression models. Here I'm going to present simplified results. The full results and discussion are, of course, in the paper. First, let's look at variables associated with intention to install among people who did not actually install the app. The figure is showing odds ratios, so if a point is to the right of the orange line, the variable is associated with being more likely to have a positive intention. Left of the orange line means less likely. What we see is that knowing at least one person who uses a contact tracing app is associated with a higher likelihood of positive intention. Believing that everyone should install the app also is associated with a higher intention. Worry about an information leaking to third parties, so a privacy concern, is associated with a lower intention to install, and stress about oneself or one's family being infected is associated with a higher intention. Our second figure focuses on whether or not people had actually installed among all participants who had an app available in their state. And what we see is that knowing at least one app user is associated with being more likely to have installed, as is believing that everyone should install the app. And the other two variables are no longer significant in this model. And based on this result, I'll briefly discuss implications for design. We found that privacy concerns were negatively associated with intention, but not with the behavior of actually installing. Now, there's two sides to this result. The first is that a lack of privacy concerns was not sufficient to drive adoption. So even if reassuring people about privacy is important, they need to have another motivation to install. The second is that people may be installing these apps despite having privacy concerns. In this case, they could have latent concerns, which could make them more likely to abandon these apps in the future. If their trust is misplaced, this could lead to even further distrust of future technologies. In sum, if people do install these apps despite having privacy concerns, it's very important for designers, governments, and health agencies to do justice to that trust. Additionally, social norms were a strong predictor of both intention and behavior. This came in the form of a descriptive norm, knowing at least one app user, and an injunctive norm, believing that everyone should install the app. Based on this finding, we argue that increasing social visibility of the apps could help increase adoption. This could be pursued through things like social sharing features and social media badges. Additionally, designers could use messaging to reinforce injunctive norms in the app, such as asserting to users, you're keeping your friends, family, and community safe, as a way to encourage them to believe that they're doing the right thing and to think that they should recommend this to other people because everyone should install. Now, we're presenting these suggestions for bridging an intention behavior gap to increase adoption, but we want to acknowledge that this presumes the apps are ultimately beneficial for individuals. HCI research has identified valid concerns about accuracy, privacy, and access of contact tracing apps, so it's very important to avoid tech solutionism. Thus, understanding how and why people make decisions about these technologies, including non-use decisions, can help us understand benefits and shortcomings so that we can address those in future designs. Thank you very much.